Welcome to Integrative Medicine Perspective. I'm Dr. Wendy Liu. We all know that the most fundamental premise of medical treatment is to avoid causing further harm. That means the outcome of our treatment shouldn't be worse than if no treatment were given. But achieving this in clinical practice isn't an easy task. Let's use weight loss as an example. The reason for losing weight is the expectation that the weight loss will translate into disease prevention, quality of life improvement, and lifespan extension. So, when we use pharmaceutical agents to treat obesity, we should evaluate our treatment methods not only by weight loss, but also by these ultimate goals. Suppose a medication causes weight loss but does not prevent disease occurrence, improve quality of life, or prolong lifespan, and comes with side effects. As a doctor, would you still recommend its use? Some time ago, a friend asked me, do you think I should use Ozempic? And then she added, don't tell me why, just say yes or no. But actually answering such a question isn't that simple. When I advised against its use, my friend asked for the reasons and said, what if I don't want to exercise or change my diet, but only wanted to use Ozempic? Is there a problem? I would say this is a typical example where a doctor's advice doesn't match a patient's wish. In real practice, when such conflicts occur, doctors do not necessarily agree on how to address them. Some believe that a patient's wish should be a major part of the decision making, but others argue that the clinical decision making shouldn't be very much based on wishes, but rather based on evidence, ideally clinical trial evidence, preferably randomized controlled clinical trials. I would like to share my thoughts on this issue and hoping it might be helpful. Let's take the example of my friend's question on Ozempic. We know Ozempic can effectively lower blood sugar and reduce weight. But this only addresses the numbers and not necessarily the root cause. Blood sugar levels and weight are merely indicators of type 2 diabetes and obesity, not the mechanism behind these conditions. The main pathologic mechanism behind type 2 diabetes and obesity is insulin resistance. Ozempic controls blood sugar and reduces weight primarily by suppressing appetite and increasing post-meal insulin secretion. But increasing insulin secretion does not reduce insulin resistance. So Ozempic does not directly correct the pathophysiology of type 2 diabetes and obesity. So it does not guarantee that the underlying metabolic disturbance, insulin resistance, will disappear after the weight loss. As a matter of fact, I have seen many very thin people with type 2 diabetes. Whether insulin resistance is resolved ultimately should be evaluated by a patient's tolerance to sugar, meaning an oral glucose tolerance test. Fasting insulin levels are often used nowadays to screen for insulin resistance, but they are not the most powerful criteria. I have not seen clinical trials of Ozempic using oral glucose tolerance test to evaluate its effect on insulin resistance. Moreover, a big part of the weight loss caused by Ozempic is muscle loss. So theoretically, Ozempic can even worsen insulin resistance. Therefore, I very much look forward to seeing clinical research on the impact of Ozempic on glucose tolerance test. Considering Ozempic might not necessarily improve insulin resistance, we need to examine if alongside lowering blood sugar and weight, it actually prevent diabetic complications and improve lifespan. This is a randomized controlled clinical trial studying the effect of Ozempic on cardiovascular disease among people with diabetes. The results showed a lower incidence of stroke and heart attacks in the Ozempic group compared to the control group. However, there was no difference between the two groups in terms of cardiovascular disease related death or overall mortality rates. The Ozempic group had lower kidney complications than the control group, but eye complications, including bleeding and blindness, were higher in the Ozempic group. Overall, the balance of benefits and risks of Ozempic in preventing diabetes-related complications might not necessarily be positive. It doesn't extend lifespan either. These results are only in comparison to the placebo control group, not against other anti-diabetic treatment. For instance, we know that physical exercise can significantly reduce the occurrence of cardiovascular diseases in people with diabetes by 38% and reduce the overall mortality rate by 49%. I would love to see all medications that alter metabolic pathways undergo randomized controlled clinical trials, with at least one of the control groups being comprehensive lifestyle intervention. Considering that Ozempic hasn't shown compelling advantages in preventing diabetes complications and reducing mortality rate, let's then consider whether it improves quality of life. If a medication doesn't reduce disease occurrence or prolong lifespan, but enhances quality of life, then such a medication would be still worth using. Pain medication would be a good example. But evidence regarding the impact of Ozempic on quality of life is still insufficient. Currently, there are no clinical trials of Ozempic primarily focusing on its impact on quality of life. A post hoc analysis using data from the aforementioned clinical trial of Ozempic's impact on cardiovascular diseases found that the Ozempic group had a statistically significant improvement in quality of life compared to the control group. However, looking solely at the absolute improvement in quality of life, the physical health score improved by only 2%. The mental health quality score improved by only 1%. Such an improvement isn't very convincing, and the clinical significance of it is minimal. If my patient tells me that his symptoms have improved by 1%, I would not consider the treatment successful. Lastly, let's summarize. Our aim in losing weight is to prevent adverse consequences related to obesity. When managing obesity, weight is merely an indicator, not the ultimate goal. Our ultimate goal is to improve quality of life and prolong lifespan. Ozempic may improve some indicators, but it may not resolve the fundamental pathology. Ultimately, it doesn't achieve the goals of improving quality of life and prolong lifespan. Instead, it might even create an illusion that because blood sugar has decreased and weight has reduced, then the consequences related to type 2 diabetes and obesity won't occur. Such an illusion is not helpful, but most likely harmful to the ultimate goals of weight loss. So weighing the pros and cons, I would not recommend Ozempic. If the decision is to use Ozempic, it is crucial to ensure that patients understand the balance of benefits and risks involved. That's all for today's discussion. Please leave comments and questions. I will see you next time.